Hello, everyone, and welcome to today's press briefing. I'm Shanda Gallego. Thank you for joining us on our CIG TV channels as well as on Radio Cayman 89.9 FM. We begin with a moment of prayer led by Pastor Ronaldo Drackett.
Across these Cayman Islands, please continue, Lord, to call our God and our Heavenly Father. We give you praise, honor, and glory for your faithfulness, and ask that you will continue to lift up every resident across these Cayman Islands. Please continue, Lord, to cover us with your grace and mercies. The challenges we face could certainly have been worse, but we thank you for the help that you have extended to each of us, especially in these Cayman Islands. Please continue to give wisdom so that we can manage the present conditions. We pray in a special way for frontline workers, especially those who are part of the medical personnel as they come in contact with infected patients. Lord, protect them, we pray, as they protect us. We pray that you will give wisdom to those in authority as they make major decisions for the well-being of the people in these islands of the sea. Please continue to cover our educational centers, cover our children, protect them, Lord, and our older residents. And oh, Father, may we continue to trust you as you lead us and protect us through this pandemic. And we just give you praise, honor, and glory for your goodness and your mercies. In Jesus' name we pray. Amen.
Thank you, Pastor Drackett, for leading us in this moment of prayer. We welcome our panelists, Premier Honorable Wayne Panton, Health and Wellness Minister, Honorable Sabrina Turner, Tourism Minister, Honorable Kenneth Bryan. In studio, we have our Interim Chief Medical Officer, Dr. Ottilia Newton, Deputy Governor, Honorable Franz Manderson, Chief Officer, Mr. Wesley Howell, Dr. Samuel Williams Rodriguez, Medical Officer of Health, other senior civil servants. We welcome our sign language interpreter, Ms. Caroline Powell. We have members of the media joining us in studio as well as on Zoom. And right now, we now hear from Premier Honorable Wayne Panton.
Thank you, Janda. Good day to all, and thank you for joining us for this important press briefing. We have come through a very challenging year, Cayman. We've seen our resolve, our resources, and our resistance put to the test. The Christmas season and the end of the year is always a special time that brings with it the opportunity for relaxation, refreshment, reuniting with those that we love. Of course, we're all grateful that we have weathered the storm to date, and it is lovely to see so many families able to reconnect and people meeting family members for the first time. But I think we should also remember and ensure that our thoughts and prayers are with those families who have suffered losses, particularly recently. Unfortunately, COVID-19 continues to be a cause for concern for us, and vigilance is required. With the Omicron variant currently raising the alarm across the globe. Yesterday, we confirmed our first case of Omicron, which has arrived on our shores. As you will hear later in today's update, we also have an additional number of suspected cases that are yet to be confirmed. Now, based on the transmissibility of the virus, we knew that it was only a matter of time before our on-island genome sequences found the variant here. In terms of hospitalizations, our hospitals have cared for 105 admissions since the 8th of September. They have supported these patients with the best health care available and used early intervention methods to get them as well as possible. Of these patients, we know that there are two things that heavily drive admissions. Those being other illnesses and those who are unvaccinated. 74% of all admissions over this period were unvaccinated. 6% had one dose of the vaccine. This means that 80% of our admissions were not fully vaccinated. The numbers, ladies and gentlemen, tell a very clear and sobering story. We also know that our medical teams have experienced and continue to experience burnout as our healthcare system has strained to support the community response needed to help keep us safe. But these people who hail from our islands and from all corners of the world continue to rise to the challenge of our recent community transmission wave, and we should be both grateful and thankful for their work and their efforts. Together, ladies and gentlemen, we must continue to keep doing what we have proven is working. Mask wearing, physical distancing, reduced gatherings, knowing your infection status, and getting vaccinated, which includes getting the booster. So while we prepare to celebrate the holidays, I want to encourage everyone to remain committed to making safe and responsible choices, and to carefully consider or reconsider the extent of their social gatherings. We must stay vigilant, as now is not the time to drop our guard, especially as we face this new challenge of Omicron variant in our fight against COVID-19. We know that there has been heightened anxiety, frustration, disappointment, and true fear as our recent local community transmission cases tested our healthcare systems, and so many adjustments had to be made, some even daily. But I want to remind everyone that there is no definitive playbook for COVID-19. We cannot be sort of doing trade-offs between lives and livelihoods. This is a false dichotomy. This three-way tug-of-war between healthcare services, protection, economic preservation, and the public's willingness to take on personal and collective responsibility for our behaviors. This challenge will be with us for some time to come. Our success is and will be in working together to keep this community as safe as possible while moving forward. Now, it is, in relation to Omicron, it is still relatively early days following the discovery of this variant, and scientists and medical professionals are still learning more about it every day. Fortunately, we already have made and put in place certain measures that other countries are now scrambling to implement in the face of Omicron. The World Health Organization has warned that given the current data, it is likely that Omicron will outpace Delta, the Delta variant, where community transmission occurs. Even though the threats of Omicron are not all yet known, we must prepare, as all countries in the world are doing. Most cases diagnosed so far have been mild. However, we cannot be complacent, as again, it's still early days of this new variant, and there's much to be learned about it. If Omicron is indeed able to spread a lot more easily than Delta, as it seems, and evades some of the protection offered by vaccines and previous COVID-19 infection, this means more people could become infected, resulting in more hospitalizations and possibly more deaths. All this considered, we have to ensure we protect our healthcare systems as we have been, and know that it is our protection and well-being which is heavily dependent upon our healthcare system's readiness and ability to respond. So as a country, we must and we will continue to take the measures necessary in response to all variants, including Omicron, to protect our healthcare system and therefore protect ourselves and those we love. While we do have the luxury of freely moving around while social distancing and masking up, we cannot be complacent. We must do our part in controlling the spread of COVID-19 and all of its variants to reduce the number of people who get ill. We're suggesting stay home from work if you can. Isolate if you are positive, and avoid, obviously, going out. We must all do our part to limit any negative spiraling effects on our bruised economy. As COVID-19 continues to evolve, we in government must remain vigilant to ensure our health and safety regulations are best suited to protect our citizens, residents, and visitors. Therefore, in response to the arrival of Omicron, the government will be making the following changes to regulations. Anyone wanting to visit healthcare facilities, care home facilities, and prisons or places of detention will now have to do the test on the day of their visit, either with a certified lateral flow test or at the facility upon their arrival. It was previously within 72 hours. Keeping our vulnerable populations safe is of paramount concern. We will remove from the regulations the provisions for large events of more than 250 persons, including partitioned venues. For now, we have to reduce the risk of superspreader events. Mandatory testing for frontline workers, regardless of their vaccination status, will also be implemented. And this can be done at the place of employment or at an approved healthcare facility. The opening hours for bars and nightclubs will change as well. These will be reduced to 12 p.m. or midnight until the 30th of December. Last week, we updated the regulations for people traveling to the Cayman Islands by reducing the COVID-19 testing window for all travelers. And this includes us Caymanians coming home and traveling to any of our 3 islands. As of tomorrow, Friday, 17th December, if you are coming into the Cayman Islands and are fully vaccinated, you will have to take either a certified lateral flow test or a PCR test no earlier than the day before travel. Again, this measure, which shortens the time between a traveler testing negative for COVID-19 and begins departing for the Cayman Islands, has been put in place to increase the protection of our community and health system against COVID-19, including the Omicron variant. There are still other things we can do. As mentioned earlier, employers, let's seriously consider reducing the density in our office buildings. Let's consider whether staff can work from home. Let's perhaps make that be the default approach as it was in the past, if you are able to do so. All of us, when it comes to socializing, we should think twice. Do I really need to gather? Do I need to go out in that large group of people? If we're going out for a gathering or a get-together, especially if it is indoors, everyone should do a lateral flow test. Knowing your COVID status to keep those you care about safe should be everyone's priority. I want to make a special appeal today. The COVID-19 vaccine has been key in keeping the Cayman Islands safe. While the vaccine remains effective in safeguarding against serious disease, recent data suggests that the vaccine becomes less effective over time, especially with the introduction of new variants. Many reports from around the world indicate that vaccination, and especially booster shots or third shots, provide the best protection against severe disease with the Omicron variant. For those who have already received 2 doses of vaccine, I urge you to take your booster. We have opened up the booster program for anyone who is over 18 and who have had the vaccine for more than 3 months. So a second shot more than 3 months. For those of you who have chosen the route of not getting vaccinated and are recovering from COVID-19, there is no clear evidence that you are less likely to get Omicron. Please come forward and get the vaccine. It is still available to you. Again, to those who have already taken the first 2 shots, I can't stress enough that there are huge benefits to getting the 3rd shot of booster. Please make the time to come out and get your booster shot if you're over 18 or have been fully vaccinated for more than 3 months. This step is, in my mind, absolutely critical in the face of the threat posed by Omicron. On a closing note, while the Ministry of Youth, Sports, Culture and Heritage have cancelled their Christmas marketplace, due to safety concerns, they will proceed with the fireworks display on Saturday, 18th December at 7 p.m. on the waterfront, and people will be able to safely watch from their vehicles. This afternoon, our Minister of Tourism will also announce some very good news for our displaced tourism workers who are still receiving the stipend, which we hope will brighten their Christmas season. Now, as we look forward to the Christmas season and safely celebrating its joy, peace, and wonder, I encourage you to pause for a moment and recognize how much we have as a community to be grateful for, even in the midst of these challenging times. Thank you for your kind attention, and I wish for all of you and yours a safe, healthy, and happy holiday season.
Premier Panton, thank you for those remarks. We now turn our attention to Health and Wellness Minister, the Honourable Sabrina Turner.
Good afternoon, everyone. The realities of COVID-19 and its impact on our society are more apparent than ever. Now, having lost a total of 9 lives to COVID-19 since the beginning of the pandemic, our deepest condolences to the families and loved ones of these precious souls. We are entering the holiday season, and we understand how close and how intimate family connections are. And even though with that pain of the loss of 9 members to this dreaded disease, there are so many of us that have lost loved ones nevertheless, that we must keep those in mind, and our thoughts and prayers are with you. Now, though since September, there's been quite an increase in the total number of cases, it is noteworthy that currently the rate of prevalence is on the decline, and the number of recorded hospital admissions have also been on a downward trend. While these indicators are very encouraging, we know that there is no time whatsoever for complacency to set in. I know that many of us are fatigued. We're tired of hearing this government and the Premier, go get vaccinated, go and get your boosters now is the new thing. And that is because it's that important. But the current truth is that we've entered a very precarious phase in COVID-19 pandemic with the newly discovered variant, Mr. Omicron. This is in our community, as we've announced yesterday, and it appears to be able to spread much faster than the previous variants. Some of the early indications having it doubling, at least the doubling time of every 2 days. This all comes in the addition of the usual increases in activities associated with the winter season, with increased travel and the opening of our borders. Now, it is important that we remain very vigilant. We cannot let our guard down, and I would urge the public to remember public health guidance of social distancing, and as our Premier alluded to earlier on, the limiting of gatherings, wearing of masks, and practicing proper hand hygiene. I must applaud a number of our supermarkets who have implemented having someone at their entrances, making sure that masks and face coverings are worn properly and that their hands are being sanitized along with the carts. Now you need to do your part in making sure that your face is properly covered during your visit to any establishment, pretty much once you leave your home. Now, I will talk a little bit specifically about Omicron, and I'm quite sure there may be some questions, and we have our interim CEO, which I'll introduce officially later on, that you can ask those questions should the need come up. But my ministry will continue to monitor this evolving situation and make the recommendations, some of which have been announced here by our Premier, in adjustments of policies and to protect our community. That, ladies and gentlemen, is of paramount importance. One of the first adjustments that will impact people was made with all household occupants of an Omicron positive case. They must isolate. Put it another way, we've done this before. If someone in your household tests positive with Omicron, you must isolate for a minimum of 14 days. Now, I know this is not welcomed by many. It is actually quite depressing for some, and no, we are not moving backwards. We need to have a control of this, and it is necessary to put these measures in place to be able to control, because we do not want a surge. I know that my ministry and public health, with the spike in Delta, we took a beating from public health about not answering calls, not sufficient staff, but let me tell you and let me assure you, we have put measures in place, we have acted on lessons learned, and we're hoping by God's grace and your cooperation and your ability to comply with all of the regulations and what we're asking you to do over this festive season, that will not be repeated. But I can assure you that measures have been put in place to remedy those situations. So what we don't want you to do is get a lateral flow positive and not report it. This thing about don't ask, don't tell will not work. Number one, it's illegal, it's reckless, and it's irresponsible. And we want you to do the right thing, not only for us. Consider this an investment. My colleague will definitely repeat this, Minister Bryan. We are doing an investment now. Christmas is all about family, intimate relationships, family gatherings. And if you have to make that little adjustment now in preparation for the next quarter, for the new year, you will thank us moving forward. But the Ministry of Health and Wellness efforts, supported by the entire government, promise that we will continue to focus on the ramping up of vaccinations and access to boosters to all persons over the age of 18 who are now eligible for a booster shot once they've had their shot more than 3 months ago. I must say, I took mine yesterday along with the Deputy Premier, and I am here and I am well, thank God. So I've done my part. Right now, there is approximately 21% of our population who have had the booster shot. That's the next push that we're going to do. We want to get that to 80, if not 90. We'd be good if we could get 100% straight across the board. We're doing what we have promised you from managing this outbreak and managing COVID by following the guidance. We have an able team that is guiding us, and this is not just going based on the wind. We are definitely being very vigilant, and we are looking at what's happening around the world. Now, the new location for the vaccination clinic is located at 131 McClendon Drive. That is next to DHL, and it's behind Price Right, at Foster's. This space was previously occupied by the Department of Children and Family Services. Older Persons Active Aging Center. And I must say we are very, very grateful to DCFS for making this property available. Now, the current vaccine schedule is always available on HSA's website, and daily updates are shared on HSA's social media channels as well. Right now, the clinic is open from 7:30 a.m. to 12 noon, Monday to Friday, but I know that those hours has been extended based on the amount of requests that has been received from the public, including those who have to work and would like those hours opening. We've heard your pleas, and we've made the necessary adjustments. Now, 10 to 2, weekends and public holidays. This new location will also provide long-term stability for the program. And it also brings together the PCR and certified lateral flow testing under one roof. Now, the PCR testing clinic is also for persons who will require testing for travel purposes and general screening and hospital preoperative admission. However, since we have seen a huge increase in the rates for booster, it was recognized that it would be much better to engage with residents in the community, and hence each week public health teams have designated a day for district outreach. And I can assure you the Premier and myself and Prospect and Savannah have seen huge numbers. My numbers last week, Thursday, was 263. So we have seen bringing these clinics into the residential areas has been accepted and embraced by all, and we will continue to do this. We are so grateful for the generosity of our partnerships in business sector for the past 18 months by allowing us to use their various facilities, such as the Owen Roberts Airports Authority, Lions Club of Tropical Gardens, and definitely Cayman Bay the Dart Group. Now, please note that community cases, which is totally different in isolation for COVID-19, still use the 3 testing centers for exit testing. Those are the Boddentown Civic Center, South Sound Community Center, and the Ed Bush Sports Complex. Even though we've opened up this new site on McClendon Drive behind Price Right, persons who are in isolation for local transmissions will not be allowed to come to that site. You continue to use those other sites, as I previously mentioned. Now, to increase accessibility and uptake, the vaccine team will also rotate through the district, as I previously stated, through the week, and the full vaccine schedule is always on the available on the website, including the operation hours. There are some operation hours also for the Christmas holidays. Let's take a look now at the children. We've gotten a number of requests for children to be vaccinated, and there's much concern around when we will be able to protect them. I can share that the government is pursuing arrangements with Pfizer for the procurement of these vaccines for our children, and this is currently progressing, and we hope that the children's vaccination program will be available sometime in the first quarter of next year, and I'm quite sure if with only 2 weeks left for Christmas, that we can look forward to that. A number of persons have also been interested in flu vaccines. These are now being offered at all district health centers Monday to Friday from 10 until 12. Outreach activities are also being coordinated with the various supermarkets and prominent locations. I think the Honorable Premier, yes, you did your flu vaccine. And yes, and he's doing well. Now, there is still much to learn about Omicron and the impact it will have. And what we do know is that its transmissibility is much higher, as I stated earlier, which means large numbers of infections can occur at the same time, which will lead to more illnesses at the same time, more admissions. And our goal has been through this reopening to slow the spread of transmission in order to protect our healthcare system and those vulnerable persons in our community. Now, more than ever, we all have to do what we have to do to slow down the spread, and in collaboration with the private and public health sectors, continue to be very encouraging. Now, HSA Doctors Hospital and Health City have demonstrated true partnership in the care of patients by facilitating patient transfers while clinically appropriate and easing the demand on resources where bed availability from one facility to the next. And we continue to closely monitor, as I stated earlier on, global trends in how to definitely help us guide these uncharted times. Now, the Medical Task Force continues to meet to update clinical guidance and accesses global trends, scientific data, and provide advice as necessary to ensure informed decision-making in keeping our community safe. The HSA has extended the operating hours of the flu clinic as well from 4 until 11 p.m. daily. Now, this dedicated flu clinic provides separate service for evaluation and care of persons with flu-like symptoms. It also does testing and identification of COVID cases. So this allows other medical services to continue with lessened risks to both patients and staff alike. Now, the HSA has also reestablished an agreement with Jasmine Healthcare Facility to use their property if necessary. And additional supply of oxygen has also been ordered pending the arrival of the HSA's oxygen generation plant to provide supplemental support of existing arrangements to ensure that we always have adequate supply of oxygen for patient care, operation, and contingency plans for any surge in COVID patients. Now, ensuring that our people have adequate access to health care during these times has been a paramount focus of this government. And with that in mind, I would like to announce the extension of the health insurance payment assistance program, and that has been extended until March of 2022. Now, just giving you an update on the field hospital, I am happy to announce that the conversation with the Family Life Center as it pertains to this field hospital is now completed, and it is waiting for its final inspection and approval by the regulatory authorities to ensure that this facility is safe for care and treatment of patients and medical staff. We anticipate those approval practically in a matter of days. And I want to take this opportunity to also thank the Cayman Islands Regiment, who played a significant part in practically allowing us to set this up in record time. Kudos to them, and it just shows joint partnership and what we can do with as much hands on deck as possible. Now let's talk just a little bit on healthcare staffing. Our efforts with recruit of staff have been ongoing and very successful thus far, with additional nurses joining the HSA by the end of the year and more to commence in early January. HSA has hired approximately 63 additional staff to assist as they're needed with administration and also with swabbing. That testing and cross-training has also been extended to additional HSA staff, being able to deploy them as needs be. And to also to have them used in the field hospital as well. I'm immensely grateful to the leadership by the Public Health Department and the Health Services Authority and the partnership with all within our healthcare sector in the continued strengthening of our response to the evolving COVID pandemic, and just straight up what service you deserve to receive once you visit our facilities. My ministry is fully supportive of your efforts, and let us remain committed to the greater good of these islands. I would like to now take this time to thank our outgoing Chief Medical Officer, Dr. John Lee, for his services, and I want to wish him all the best on his future endeavors. Now, recruitment is ongoing for Dr. Lee's successor, but we are fortunate to have joined our team interim CMO, Dr. Otelia Newton. And Dr. Newton is an infectious disease expert with extensive experience in public health, who previously served as the UK's Health Secretary Agency's Overseas Territories Advisor. She has assisted many of our fellow territories, such as Turks and Caicos, Gibraltar, in COVID-19 management, and we are pleased to have her with us at this critical time. To everyone, I want to wish you a safe and healthy holiday season, and I can't say it enough. Please get the mindset out of your head that don't ask, don't tell. If you test positive on LFT, that you're not going to report it because you're not sniffly. If you're even going to your families to have Christmas dinner or to celebrate this festive season, consider doing an LFT before visiting. And for God's sake, if it tests positive, do not go. I have been impacted by the recklessness, and I too have shared my loss when it comes to family, and I don't want that to be repeated. We all have to adjust our behaviors if we're going to definitely keep our community safe. God bless, and thank you for your attention.
Thank you, Honorable Minister Sabrina Turner. I believe at this time we are welcoming our Interim Chief Medical Officer, Dr. Ottilia Newton.
Good evening, good afternoon, and very happy, It's a great honor to be here and to take the position of the Chief Medical Officer. It is incredibly, it's incredibly challenging, above all because I follow in the footsteps of a great medical officer, Dr. John Lee, to whom goes all our gratitude for what he has done in this time. So I'm hoping to do maybe not as well as him, but as well as I can, according to my ability, to my possibility. Thank you.
Thank you, Dr. Newton, and welcome once again. At this time, we now turn our attention to our Tourism Minister, the Honourable Kenneth Bryan.
Good afternoon, everybody. It's a pleasure to speak to everyone. Before I get into my remarks, I just want to say a special thanks on behalf of all the good people of the Cayman Islands to Dr. Lee. A long journey. He's done us very, very well under some challenging circumstances from a political level, from a medical level, and all in between. We thank you very, very much for all that you've done, and wish you in your next journey along all the blessings on you and your family. With that being said, I think my colleagues have said a lot, so I'm going to keep it quite simple and straightforward today and take questions after. A very pleasant good afternoon to the viewing public who have tuned in to this broadcast, as well as to those who have joined us here in the studio. I'm going to be speaking a little bit about the cruise. As you know, we announced in Parliament that the government took a strategic decision to allow the Holland American cruise ship to call on Grand Cayman on Tuesday, the 28th of December 2021. And to confirm, the cruise is still going forward in light of the recent developments of Omicron. The cruise ship was approved to call on Grand Cayman because it has been able to meet the 7 safety protocols stipulated by government. And I've sat and spoke with the cruise line to go over the developments of Omicron, and their safety protocols by CDC have also been examined in respect to this, and the safety protocols they have in place should cover that. The cruise call will be an important opportunity for us to test our safety protocols that are in place, and will give us time to make the necessary adjustments that may be necessary so that we can confidently welcome more cruises in the new year, providing obviously that they meet the criteria that we put in place. And those stipulations are that they must first call on Grand Cayman as the first port of call. Passengers' capacities are limited to 60% of the vessel, and for this vessel in particular, that is 1,600 persons. All guests and crew must be fully vaccinated with an approved COVID-19 vaccine at least 14 days prior to the start of the cruise. And 4, all guests must have a negative PCR test or antigen test taken within 2 days of their embarkation. All guests and crews going ashore must observe local requirements regarding face mask and social distancing and others. And last but certainly not least, no unwell guests or crew will be allowed on shore. The cruise industry is a very important part of our overall tourism industry, and many Caymanians are employed servicing this aspect of our tourism industry and are hoping for a steady and safe redevelopment. We have to get the cruise sector back up and running so that we can get our people back to work. But in doing so, that we are making sure that it's safe for cruise ships and cruise passengers to return. I'm going to move now on to the very important part that you heard the Honorable Premier say, that we have a special announcement, and that is all stipend recipients will be receiving an extra $500 for the Christmas period. In light, normally, if they were working, employers would have probably given them a bonus, and as we can tell, cost of living is not decreasing as yet. In addition to that, I would also like to remind the stipend recipients that as of the 1st of January 2022, the management of the stipend program will be moving to the Ministry of Labour. This is because the Ministry of Labour has a staff with the expertise in dealing with labour matters, and they can provide more assistance to stipend recipients to help them find jobs and transition back into the workforce. Now, turning on to what I consider even more good news is children travel. Government will be reviewing the travel policy relating to children with the hopes that unvaccinated children will be able to take their parents' vaccination status for the purpose of travel. With the availability of vaccinations for children over the age of 5 years increasing, particularly that of in the UK and the United States, this means that a higher percentage of travelers aged 5 and above are more likely to be vaccinated in the coming months. This also means that the risk levels among travelers will significantly be reduced, as the only group of people who cannot be vaccinated will be children 5 and below. Unless Omicron presents some unanticipated difficulties, we are hoping that when the situation is reviewed on the first week of January, the circumstances at that time will allow the government to proceed with implementing this new travel policy for children and that will hopefully start from mid-January to the end of January. So in that vein, I'm going to follow up on what the Honourable Minister of Health and Wellness said. Please be safe this Christmas. If you can avoid large functions, do not go, because we will not be able to move forward in a safe way for the children travel policy if we have a severe wave. Even without Omicron, we still have to be safe. And in light of Omicron and its speed of transmissibility, we encourage you, use this Christmas to be more intimate and close with your family. Enjoy your family time at home. You know, remember what the season is about. It's about family and it's about God. So try your best. If you can avoid that event this year, do so, because Omicron is coming at a very special time. So I'll leave it there until the questions come. Thank you.
Thank you, Minister Brian, for your remarks. We now turn to members of the media with questions, and in the interest of time, and I'm getting a cue that we're supposed to be getting some remarks from our Dr. Samuel Williams Rodriguez, from Dr. Newton. My apologies. We're going to turn it over to our interim chief medical officer once again, Dr. Attilia Newton.
Thank you, Speaker. So the stats for the most recent ones are, let's start with vaccinations. And these are for the day, the 14th of December. We have had a total of 444 doses given, divided as follows. First dose, 50, second dose, 82, and boosters, 312, which is very good news. The cumulative statistics for vaccination as for the 13th of December, we have first dose total 58,386, which means 82% of the eligible population. Second dose, 56,182, which is 79% of the eligible population. And the booster is 13,828, which is 19.4% of the eligible population. This is on the 13th of December. As per the number of cases that we have had in total so far, we have had 8,062. Of these, 16 were, no, not 16, sorry, at the moment we have 16 people in hospital. 3 of these are in CCU requiring intensive care. We have the total number of fully recovered individuals from the start of the pandemic is 4,627. Cases linked to the community is 3,410. And the total number of lateral positive lateral flow tests is 2,110. Thank you.
Thank you, Dr. Newton. We now turn to members of the public with questions. And again, in the interest of time, we are limiting our questions to 4 per media house. And if there is time, we'll allow for more. We first start with Compass Media's Norma Connolly.
Good afternoon, everybody.
Good afternoon.
Hi there. My first question relates to the travel restrictions for incoming travellers from certain countries. When the Omicron was first found in South Africa and in other countries in Southern Africa, 10 countries were named as part of that list. Are those restrictions still in place for those 10 countries? And is there any thought at this point of maybe expanding the restrictions to other countries, considering that the WHO has said it's been found in more than 77 countries so far?
Happy holidays to you. Just to answer your question, we recognize that Omicron obviously is spreading as fast as it is, and now obviously in many other countries, we will be reviewing the policy and regulations, and hopefully can have an update to you in the coming days.
Okay, so currently anyone coming in from any of those 10 countries will still be required to quarantine?
Yes, it's still in effect at the moment until the regulations change, but we do recognize the obvious problem that is created, which is there's other countries now with Omicron quite prevalent.
Okay. Could I ask as well, the original Omicron positive patient here in Cayman, or maybe he's not a patient, but who tested positive, was that person in quarantine when they tested positive, or were they placed in quarantine after testing positive?
We are going to call on Dr. Samuel Williams Rodriguez to answer that question.
Hi, good afternoon. Thanks for the question. The first case that we have of suspected Omicron was detected on the second day by lateral flow test, and immediately the patient was placed in isolation alongside his the family, and we did PCR tests where the S gene dropout was found. And then consequently, we complete sequencing for this patient, and we have confirmed now that the patient actually had the Omicron variant. The patient was not symptomatic, but the patient is currently in isolation alongside their family.
So for 2 days, that person would have been out in the community?
That's correct.
Until they did that test?
Correct. The patient is fully vaccinated, arrived on island with a PCR test done 72 hours before traveling, and again, the patient was asymptomatic during that period.
Okay, this sort of leads me on to my next question, which I think Minister Turner referred to this earlier about household members of people who are Omicron positive, that they need to quarantine for 14 days. But how will a person know that they're Omicron positive? I mean, I understand you can tell from the PCR test because of the dropout, but obviously, if you take a lateral flow test, you're positive. There's then obviously a lag before public health can test you and get a PCR test done for you. So in the meantime, maybe you're in isolation, but your family and your household members aren't. So how is this being addressed? Can you talk me through the process?
Well, for travelers, as soon as the LFT test is positive, they need to isolate alongside with the family. We will test the positive person immediately, usually within 24 hours, and we will have the report of the PCR within 4 to 6 hours. That will give us an idea if the person has the S gene dropout, which is a strong indicator of the Omicron variant. We then keep the family, if this is the case, in mandatory quarantine until we get the result of the sequencing. If the person is still positive but doesn't have the S gene dropout, the family can go in daily lateral flow test, but the person will continue to be in mandatory isolation.
Okay, so the household will remain in quarantine with them until it's confirmed that it's Omicron or not?
That's correct.
Okay, and I think I get one more question, and that relates to something that was mentioned in a press release a few days ago. It said that PCR tests for outgoing travelers, so people who live in Cayman who want to travel away from here, that the cost of that will no longer be picked up by government and the traveler themselves will need to pay for it. When does that come into effect and how much is that going to cost?
That's a question for government. Really.
Yes, that comes into effect.
Thank you, Dr. Rodriguez.
Thank you.
Thank you. That comes into effect as of the 17th, and government has not actually are doing a price with that. It is based on the facility that is offering. However, we did say $25, but we're not here to. That was LFT, yes. So no, for the PCR, that will be based on the facilities. But it comes into effect as of the 17th.
I see. Great. Thank you very much, Minister Turner. That's all my questions from now.
You're welcome.
Thank you to Compass Media's Norma Connolly. And I believe we now have Wendy Ledger from Cayman News Service.
Hi, Sandra. Thank you. Can I start with Dr. Williams, please? I just have a follow-up with regards to the situation relating to testing and the Omicron variant.
I think we may have lost her. Wendy, are you still there?
No, I'm waiting. I just don't see Dr. Williams. Is he there?
Here, go ahead. Go ahead.
Yeah. Okay, I'll ask my question. Can you tell us where the confirmed patient travelled from? Was it the UK? And also the suspected cases and how many suspected cases there are, because we didn't get any daily numbers just then.
Okay, the confirmed case traveled from the US. We currently have 10 more suspected cases. Out of those, 9 are travelers and 1 is a household member of a traveler. Most of them have come from the US, and we have 1 case coming from Canada, 1 from Mexico, and 1 from the UK.
Okay, so it's only 1 from the UK. So I was just going to say, I was going to ask government, is there any plans to target quarantining for UK travellers, given that it seems that the UK at the moment has the most cases of Omicron in the world?
Wendy, this is Wayne Panton responding on that. We do not have any plans to, to impose that sort of approach, and I don't think public health utilizing their discretion probably do either. But Dr. Williams can confirm that.
Thank you. Thanks, Mr. Panton.
Can I add to that, Wendy? Ultimately, what you would be suggesting is going back to no opportunity for no quarantine.
Isolation.
Isolation. Everybody would be isolated to some degree, whether it's 7, 5, 10, or whatever is recommended. And that will ultimately, in my humble opinion, kill the tourism product all over again. Now, obviously, if that was the advice given to us, then we would do so. But thankfully, there's no indication that we would go down that road right now, unless Omicron conspires against us.
Okay. Whilst I'm on the government panel, can I also just clarify, was that most definitely all bars, restaurants, clubs, etc. from when will have to start closing by midnight? Can you just confirm those details?
Wendy, we have not put that in effect yet, so it will be published probably by tomorrow evening. So it would go in effect by tomorrow evening. We have not actually put it in effect yet, but once it's published, once the regulations in respect to that are published, then it would be from that point forward.
And I heard you correctly that that's all, everywhere has to shut at midnight.
Yes.
Okay. I think I've got one more question left, if that's all right. Sorry, it's too many windows. Oh yes, during Finance Committee, I'm not sure you're going to be able to answer this because it was actually the ministry, it was the Minister of Finance that said it, but during Finance Committee, he pointed out that no state of emergency was ever declared surrounding the whole the whole COVID pandemic from the get-go, and that had presented difficulties to government for procuring certain types of tests or medicines or whatever, and it had effectively created a difficulty. So I'm just wondering whether it would be, you've reached the point where you think, A, you should have declared a state of emergency, and perhaps given the fact that we're now facing another very dangerous wave, that perhaps government should declare a state of emergency.
Wendy, I think the context in which the Minister and Deputy Premier was speaking at that time was around procurement and the ability to speed up procurement processes if a state of emergency is declared. Obviously, if a state of emergency is declared, that changes the nature of the government's position as well, and effectively gives the governor very specific authority, which, there's going to be reluctance for that sort of approach to be taken on both sides, as you might imagine. So we don't think that this represents something which is which should drive a decision for a state of emergency, but this is a very serious situation with Omicron. If we do have Omicron that turns into community transmission here, it will spread very, very rapidly, and we have real concerns about that. That is why we are taking the steps that we're taking, announcing the steps that we're taking this afternoon. The Omicron is apparently a variant which can spread multiple times faster than Delta. There's a recent article in the Economist magazine, which I think, going from memory, on December 8th, the UK had something like 536 cases of Omicron, and by December 14th, it was in excess of 10,000. So it gives you an impression of the dizzying exponential growth in infection that is possible with this particular variant, and it is why it's really of significant concern all over the world, not just obviously here, but it is specifically so for us because, as we have discussed many times in the past, we are an island. We do not have the ability to bring in help from hospitals easily from an hour's drive away. So, we have to ensure that we take the steps necessary to protect our people and protect our ability for our healthcare system to make them safe and make them well.
Okay.
Thank you, Wendy, from Cayman News Service. We will go now to Radio Cayman's April Cummings.
Hi, everyone. Thank you very much. I'm having a hard time putting this question in the form of a question. So You may have to bear with me for a second. So as I'm reading about Omicron as well, it feels like the biggest concern is the speed with which it moves, essentially. Yet the data doesn't seem to imply that this makes people sicker than perhaps the other versions, or that they're necessarily a corresponding increase in hospitalizations at this point. So for me, I'm just struggling with the idea that, yes, it moves quickly, but we don't know that it is just as bad as, or worse than what we've been experiencing previously. So I'm just trying to get a sense of the big picture on why we're responding the way that we are to it, without me understanding that it's as dangerous, if you will. And it may be. I just need some help kind of wrapping my head around that.
Well, I'm actually going to turn that to Dr. Newton to see if she could address that.
Okay. Thank you very much for your question, which is very legitimate, and I'm sure a lot of people are trying to get their head around. So I'll try to give you as simple explanation as possible, but please do ask more if it is not clear enough. So this is a variant which has got a lot of mutations, and this is why when it first appeared, WHO said there is concern here. Was first of interest, and then it moved very quickly to a variant of concern. And having done so, what they saw was this extremely rapid spread of this variant, which means that it has an ability to infect people, even people who have already had the previous infection with the Delta or with the original Alpha or the original Wuhan, and even people who have been vaccinated. Then there have been, obviously, very quick laboratory studies in trying to see in laboratory environment, is this variant responding to the vaccine, and what is the response, or what, And the first studies that came out, they did say, oh, well, the response to the vaccine doesn't seem to be very, very good. And this was because they were just measuring antibodies. But the immunoresponse, so the response that our body gives when it comes in contact with a virus, is not just based on antibodies, it's also based on special cells, which are the T cells, which are our memory cells, and so on. So to gather the information on whether the vaccines we have now will stimulate an appropriate T cell response to this variant, you need a bit more time, and you need to see what's happened in people who get the infection with Omicron. So just to give you a very simple practical examples, in the UK, a couple of days ago, there was the CMO responding to the Parliamentary Health Committee, and he or his assistants said, so far we have 15 people in hospital in the UK with Omicron. We need 250 to get a better idea on how much protective are the current vaccine against Omicron. In the sense of, specifically, we want to understand how much the vaccines protect an individual from severe disease and from death. So, having said all that, which means that we have to wait a bit longer to know what is the real impact of Omicron. What is against us is the fact that it spreads so fast And inevitably, you will have a number of cases ending in hospital. This is why it's very legitimate that we take some measures. We don't go in a full lockdown, which won't be justifiable at this stage, but we take as many measures and as many precautions as possible to try to slow it down while more information becomes available. So does this answer a bit your question and gives you a picture of where we are and why we are doing that?
So essentially, it's trying to mitigate the possibility that it's worse than we know, because you haven't had time to find that out just yet in real life.
I think that summarized pretty well, and you know, because we are going towards Christmas, where people tend to gather together more. This is where the concern comes. We don't know enough yet, so we can't really be completely, saying, oh yes, and it's much more, mild, and let's not do anything. So we have to be very careful at this stage.
Thank you, Dr. Newton.
Thank you very much.
April, if I could just add to that in terms of put it in context here, and I've also sent you that link to the Economist article, which I referred to earlier. But that article talks about the possibility that it might not generate any additional sickness than Delta, for example. But because it spread so rapidly, from the individual perspective, you think, well, because it doesn't make us any sicker, perhaps we shouldn't be concerned about it. But from a public health perspective, the fact that it spread so rapidly means that the public health and the health services could get overwhelmed very easily. So, I mean, if we use our example here, I think at our peak we had about, 4,000 or 5,000 people that were infected. If we doubled or tripled that, that will give you an example of what kinds of challenge we would be facing as a small island. And then, of course, while you may not have a lot more people getting sick because the numbers have gone up so much, you are going to have a lot more people going into hospital. So this is about trying to avoid the speed of growth in infections overwhelming the public health system. And that's why we're so concerned about trying to keep it under control and put in these measures to try to limit the level of community transmission.
So if we're already, and I understand we have more resources coming in, we're trying to work through the kinks, but the issue is if I have trouble getting someone to answer a phone today, it would be that much worse if we didn't do something now to mitigate that potential flow of people.
Yeah, I mean, it could be even worse than that. We have a stress system when we had a lot of community transmission with people in public health being tired and overworked, people in the hospitals being tired as well. If they've got 2.5 times or 2 times the amount of workload generated by Omicron, that's going to be double the problem. So that's why, from our perspective, from government's perspective, we want to try to do whatever we can to try to limit the level of community transmission, so that we help to protect the integrity of our public health system, our health services system, and their ability to keep us all healthy.
One more question, and Mr. Premier, I think it was you who touched on this, so perhaps you can clarify it for us. I heard the discussion about the public gatherings. You mentioned something about 250. I just need some clarity on what that actually looks like. Because we're at limits of 100 and then potentially 250 if you have partitions and such. So where would we be next and when? So
what the previous set of control and management of COVID regs allowed, in general, a limit of 100 people within indoors, and a maximum of 250 people outdoors. It also had a separate provision which would allow, for example, venues to divide up their premises and separate people into groups of 250, as long as they were kept separate and not allowed to mix. And that could also be in addition to the 100 that would be indoors. A third scenario was the ability to allow basically any number of people to gather, provided that they had a certified LFT negative within the previous 72 hours. We think the risks around the latter two scenarios are too great at this point. Going into this season, we all recognize that it may cause some difficulties for people, particularly those who want to celebrate the festive season. My colleagues have done a good job in, as well as, I guess, in addition to, I should say, my input on it, in terms of encouraging people to, minimize their amount of socializing. But those two scenarios are the scenarios that I was referring to, meaning the scenarios with the separated groupings of 250, and then the lateral flow test scenario where you had almost an unlimited number of people. That one is clearly a real concern. Even the one with the segregation into 250 lots has proven to be problematic in the sense that from observation we've seen providers and premises which have done or proposed to do things like that, but for example they don't have separate bathroom facilities for each of those segregated 250 people. So everybody's sharing the same bathroom facility, and that clearly goes against the regulations in terms of avoiding mixing. So those two scenarios in particular are ones that we're looking at in terms of proposing to make changes, probably by tomorrow evening.
And before Shanda cuts me off, and she would be right to do so, I forgot to ask about the next phase. How is what we're experiencing now impacting, when we'll look at moving to the next phase or not, in terms of reopening?
Well, I think Minister Brian specifically mentioned that we would at the end of the year we would have a look at what the picture looks like for us. I think we always said that there would be several weeks after the reopening that we would have a look at this. Now, at this point, you may say, well, we're several weeks after the reopening, but we didn't anticipate that, on November 24th or whatever it was, we would have Omicron being identified, and that in the space of several weeks, it would have gone from being identified in one country to being, basically in 77 plus countries around the world, and probably many others. Just to give you an example, I'm not trying to scare anybody, but I came in here this afternoon believing that we had one confirmed case and 5 additional suspected cases. So it was news to me to have my colleague Minister Turner, it was the chief, the medical officer of health, Dr. Williams, announced that we have an additional 10 suspected cases rather than just 5. So, the circumstances are changing, and we will assess at the end of the year what things look like. If we're lucky, we may be in a position to reconsider phase 5, but it may well not be the case either. So,
no party, and that's what that means.
What we're trying to achieve here, and what we're trying to encourage here, is our population and our people to help us to get to a position where we move into the new year in a good way rather than in the worst possible way.
Thank you very much. I appreciate your time.
Thank you, April Cummings from Radio Cayman. We turn now to Ralph Lewis from Caymanian Times.
Good afternoon, Shannon. Thank you, and good afternoon, members of the panel. It's good to go last. We don't have much questions to ask. So I'll be very brief. Just two questions. Mr. Premier, and in your wrapping up speech, could you just repeat those new measures that you'll be putting into place very soon? And I have a question for the Dr. Newton. If you could come, please.
So which you want to go with her first, and then I'll repeat.
Yes, and then you can answer my question in the wrap up as you.
Sure.
Yes.
I think she takes her spot there.
Okay. Welcome to the Cayman Islands, and sorry to put you on the spot. I keep getting requests for more statistics, and I've asked that in the past. At one point, we were getting a number of folks who were symptomatic and who were not symptomatic, and those have been pulled away. Going forward, are we going to get some more detailed statistics and also separate the regular cases from Omicron cases? Information is critical, and the more people have, the more they can understand. There were some questions about deaths, whether how many were vaccinated from how many were not vaccinated, and those questions, if not answered, can reach to speculations. And so as we go forward, I don't want to ask all those questions today because I may not have the answers, but could you be more forthcoming with some of those descriptions? We understand it might be, sort of traumatic for some people, but it helps us understand better.
Absolutely, and you are in your right to ask for this question. We are doing quite a bit of work in trying to revamp the daily information which is circulated amongst the authorities and is presented to cabinet, and already that, trying to streamline it, trying to look at, your hospital admissions, but also the sort of things that you're saying. So saying, for example, okay, we have had a total of 9 deaths. How many of these were vaccinated, and how many were unvaccinated? I don't know it now on top of my head. The majority were definitely non-vaccinated. Right. And when you have the vaccinated one dying, unfortunately, it's because these are people really without severe comorbidity. We will be starting collecting and presenting information on the Omicron, because that now becomes quite essential. The testing of the confirmation of a new variant is quite complicated things because you have to do genome sequencing. But in Cayman, you are very, very advanced on that because you have the service locally. So you don't have to send the samples out. Already takes 4 or 5 days to do it. If you have to send it overseas and then get it back, it will take a long time. So, yeah, definitely that's a promise.
Thank you very much.
Thank you.
Okay. No.
Thank you, Mr. Lewis, for the question. Basically, there was 4 main points. One was for those people who are seeking to visit healthcare facilities, home care facilities, or let me put it the other way around, care home facilities, and prisons or other places of detention, they would have to do the certified lateral flow test on the day of their visit through a certified provider, or they could do it at the facility itself, obviously in the presence of staff there. And previously that was 72 hours. In addition, we were, as we discussed earlier, removing the regulations around the provisions for large events of more than 250 persons who can do the lateral flow test. So there would be an unlimited number of people who could just do a lateral flow test within the last 3 days and then be authorized to enter that sort of event. And then secondarily, or in addition rather, we were going to be removing the provisions which relate to partitioning of the 250 persons. So effectively, we're going back to where we were originally, where we had public gathering limits of 100 people indoors and a maximum of 250 people outdoors. And of course, you can have the two things together, but you have to have separate facilities and avoid those people mixing.
Okay, thank you. and the other one? The closing hours.
Yeah, right. So the discussion was, the last one I think mainly was the discussion around, last two really, discussion around mandatory testing for frontline workers.
Yes, that's right.
And then there was the closing of bars and nightclubs at midnight. The final one, which came out in questions that we were discussing, was really around the removal of countries that are on our restricted list at the moment. Given the current level of distribution of COVID around the world, it really doesn't make any sense to effectively punish certain countries right now when it has spread so widely. So we will be looking at, as the UK are doing, they're looking at removing the 11 countries I think that are on their red list. I don't remember how many countries we had on ours, but it was a lot of the Southern African countries, and then it was Belgium as well. And I think we'll be looking at removing those from our list.
Okay, then. One follow-up question. Will the RCIP be visiting those facilities to ensure that whatever regulations they put in place will be adhered to?
Sorry, can you repeat the question?
Will the RCIP...
Will they?
Yeah.
Yes.
Will they be?
Yes. Yeah. Unfortunately, we will be asking them to ensure that people are complying with the legal requirements under the regulations. It will also possibly include inspectors from the liquor licensing department as well.
Thank you very much, Premier.
Thank you, Ralph, from Caymanian Times. Premier Panton, just for clarification, when you mentioned the limitation on public gatherings, you're including funerals and weddings, right? Is that so? Can you confirm that?
Sorry, can you repeat
the restriction on public gatherings?
Me for everything.
That includes
Yes.
Funerals and weddings.
I think it does, yeah.
And also another need for clarification, the aspect on the closure at midnight, that goes into effect tomorrow. Can you confirm that?
Well, it goes into effect whenever the provisions are adopted. Sorry, not adopted, but published in the Gazette. So we'll publish it in the Gazette. We may also provide that as soon as it's published somewhere officially, like on government's website, it might go into effect at that point as well. But the regulations themselves will make it very clear.
Okay, thank you, Premier Panton.
I think, Premier, I'd like to add that I think the missing point is that we intend to have a cabinet tomorrow to finalize that. Once that is completed, then it will go out for Gazette. So the hope and expectation is that nothing serially happens between now and tomorrow, that it should be out for tomorrow.
Okay, thank you. Thank you for that. Before we close, I'd like to ask our panelists if they have final and brief comments. Final comments.
I do.
Go ahead.
As always, do apologize. I have a few. I think that there's some points that I have to clarify, particularly in respect to the stipend. I see that I get a lot of messages being happy about the Christmas bonus. The intention is to have that bonus paid into the recipients of the stipends accounts before Christmas Day. Obviously, in light of the announcement, and everybody's busy now during Christmas, we'll try to make sure that happens. I would also like to thank the Honourable Deputy Premier and obviously the Premier and my colleagues for supporting this to find the savings in this difficult time, and to remind the stipend recipients that not only the Ministry of Labour will be taking over the responsibilities as of January 1st, but this expectation is to last at least for the first quarter of next year. But there will be a transition period whereby they work with you to try to find you work, because it is, I think it's fair to say that we cannot continue to pay the stipends forever. Also, I want to remind the taxi drivers and tour operators, if you have not been vaccinated yet, please do. It's so important. You are one of the key frontline workers in respect to our tourism product, along with the other players. But not only for your own safety, but for the safety of the passengers that are in your vehicles. Get vaccinated. And this is an encouragement to all Caymanians to get vaccinated. If you're already vaccinated, go get your booster if you meet the mark. I've done mine, so you should do yours too. And because this is probably going to be the last time we speak to the reporters who are a key component to the communications with us and the people, thank you for your continued job through 2021. I wish you a merry and happy new year and a Merry Christmas. So thank you for that. And I think the last thing was, I love you, Cayman. Merry Christmas, Happy New Year. Take care of yourself.
Thank you, Minister Bryan. I believe Minister Turner
Yes,
has some final comments.
Yes, thank you. Very quickly, to give some opening hours of the clinic at the new site, walk-in COVID-19 testing clinic hours from Monday to Friday from 7:30 to 12, Saturday from 10 until 12, Sunday from 10 to 2, and from 10 a.m. to 12 for PCR, from 10 a.m. to 2 for certified lateral flow. Not leaving out our sister islands, the Cayman Brat Flu Clinic is happens at the Aston Rutty Centre for lateral flow testing from Monday to Friday from 9 to 1, and then from 2 to 3 for PCR testing Monday to Friday 9 to 12. Saturday, Sunday, and public holidays, we are asked you to call for an appointment. That's 244-7620. And over in Little Cayman, to call for an appointment, you call 948-0072 or 916-5395. So we're able to do testing now 7 days a week. And I'd like to encourage, that as we've advised by the CMO, that everyone that tests positive on a lateral flow should be PCR tested due to the risk of Omicron. So do not take those positive results from a lateral flow lightly. The only how we're able to determine what variant you do have is by getting that sampling on the swab taken by a PCR for us to confirm what variant it is. I would like to take this opportunity to thank my colleagues and all the staff, all the industry stakeholders, but also for Cayman, for all the people that are doing the right things. I mean, some of you are admirable in making sure that you are reporting your positives on the LFTs, and we're making New Year's resolutions. Let's make some resolutions in investing in our health, and by incorporating healthy habits, healthy public health, non-medical hygienes. Let's change our eating habits and look for a bigger, brighter, better 2022. Thank you.
Thank you, Minister Turner. And Premier Panton, over to you.
Thank you very much, Chanda. I want to thank everybody who has joined us this afternoon. And I, in particular, want to extend officially a very, very warm and kind Caymanian welcome to Dr. Newton for joining us as the interim CMO. Dr. Lee, who is leaving us, obviously, what can you say about him? He has done an excellent job. His care, his compassion, his composure under pressure has been second to none. And we very, very much will miss him. And we thank him very much for the service that he's provided to the country, to the people of the Cayman Islands. But I'm sure Dr. Newton will be able to, fill his shoes, so to speak. But it's interesting, he was here at a time when this pandemic started, and he provided us with excellent guidance through it. I don't suppose that she imagined that she would be coming back at a time when we face another sort of unknown huge difficulty in the form of Omicron. So, Dr. Talia, we will be leaning on you for your continued guidance, and I'm sure you will do as equally good a job as Dr. Lee did in that respect. So thank you very much. I want to thank everybody that was here and did presentations. I want to say to the people of Cayman, and I want to join with my colleagues in saying, please, let's take this seriously. Let's, reflect the fact that Christmas is about families. Don't feel that, you're losing out by if you decide not to go out and socialize as much. We think that this is about us getting safely into 2022, and our concern is to make sure that the people of this country and the people of this wonderful island are all safe and we all get there together. So Merry Christmas and Happy New Year to everybody. If we don't speak before then, and let's all be safe. Let's all get there together. Thank you.
Thank you, Premier Panton. I just want to thank each and every one of you for your patience, as well as the questions that we get in for each of these COVID press briefings. I acknowledge them, and I would really like to just squeeze this last one in because I do believe that it is important. This question is asked, if fully vaccinated, does that now mean 3, not 2 doses? I am not sure who can confirm this, but the question is being asked, fully vaccinated, does that mean 3, not 2? And I think we're going to ask Dr. Williams Rodriguez to address that.
All right, thanks for the question. Fully vaccinated is still 2 vaccines. We are recommending everyone to get the 3rd dose because they have proven to show protection, additional protection, even for the Omicron so far with the information we have. But fully vaccinated is considered 2 doses still. Okay.
Thank you, and I hope that answers the question.
Go get your boosters. Yeah.
Correct.
Thank you, Dr. Williams. Thank you to our panelists, Premier Panton, Minister Turner, and Minister Bryan. We would like to thank and also again welcome our Interim Chief Medical Officer, Dr. Ottilia Newton, senior civil servants, our sign language interpreter, Ms. Carolyn Powell, members of the media, and to you, our listening and viewing audiences. Thank you so much for joining us today. A reminder that you can watch today's press briefing in its entirety here on CIGTV YouTube and Facebook channels, as well as directly after the 6 p.m. evening news on Radio Cayman 89.9 FM. You're encouraged to go to gov.ky, hsa.ky for the very latest COVID news and information. Until next time, Merry Christmas, Happy New Year. Be safe, everyone. Take care and God bless.